Hi, I'm Brandon Leonard with Men's Health Network, and I'm here in Washington, D.C. at the Dialogue on Men's Health meeting discussing initiatives to improve the health of men and boys across the lifespan. And I'm speaking with Dr. Sal Giorgianni, who is chair of the Men's Health Caucus in the American Public Health Association. So thank you for joining us, Dr.
Thank you for having me.
Great. So I wanted to ask you, you're one of the founders and the current chair of the Men's Health Caucus in the American Public Health Association. Can you give us a little perspective on the genesis of that group and what its goals are within the APHA?
The American Public Health Association, as you know, Brandon, is the largest public health association in the world. Over 65,000 professionals that span public health community, from state health departments to medical practitioners to government agencies in the federal sector, looking out for the public health of Americans. The Men's Health Caucus was just authorized by the American Public Health Association in 2010 to form. And our objectives really are to serve as a focal point, as an expert constituency, as a resource to folks in the American Public Health Association, and outwards about how to enhance the health of boys and men in America.
Great. Can you tell us about some of the major strategic initiatives and policy goals for the Men's Health Caucus?
Yeah, we have 5 strategic initiatives, and they were published in 2011 as the 5 core policy platforms for American Public Health Association. The first is to talk about policy development. We find that there isn't enough focus on the part of legislatures, whether it's federal or state, on how to deliver health care in a meaningful way to boys and men. So one of our core platforms is to facilitate an understanding of the issues that are important to boys and men, and the ability for legislators to incorporate those precepts into legislation and authorization and hence funding. The other is research. When you look at how we deliver health care, there's a dearth, a lack of research on how to deliver health care in the optimum way with gender-specific rhetoric, imagery, context, particularly for boys and men. So one of the things that we very much want to do is look at the gender differences from the perspective of men's health. The third is education and outreach. So important. We have to get the message to boys and men that they have to be empowered for their own health, that they're responsible for their health, that they are advocates for their own health, and they have to go to the doctor, get health visits, and engage in healthy and well behaviors. So that's through education and outreach and programming. The fourth is professional training. We have surveyed medical schools, health department program, public health schools, pharmacy schools, nursing schools, and there are only 13, believe it or not, 13 programs in men's health in all of those professional programs. And what we believe would be important is, just as there are studies and courses in how to properly communicate with girls and women about health care, how to properly diagnose and treat the gender-specific issues of women and girls, we need those in professional training. So that's our fourth platform. And our fifth platform is access to health care. So important, and the Affordable Care Act is a linchpin to this. It's so important for men to be able to access health care, but we also want to take it to the next step. Just because you have an insurance card doesn't necessarily mean that boys and men will go to get health care. In fact, women are 100% more likely to go to a health care visit in a 2-year period than are men. And only 30% of men, about 80% of women, can identify a primary health care provider. So one of our issues is not only giving them access, but also that educational component. So we work through our constituencies, through our membership, through anybody who's interested, really, including the Men's Health Network, of course, on how to get men more engaged in health.
So the Men's Health Caucus and the American Public Health Association has, from the outset, been a strong supporter of this Dialogue on Men's Health series. And you were the lead author on the first publication of the Dialogue series, A Framework for Enhancing the Health of Men and Boys in America. Could you provide some insight on this landmark publication and what goals you think the APHA Men's Health Caucus would like to see from the Dialogue Initiative?
Yeah, Brandon, thanks for bringing it up. I just happen to have a copy of it with me.
Great.
Because it is very, very important. There are very few national level publications that talk about policy perspectives on men and health. And our initiative in this dialogue was not just an initiative of one group, but an initiative of 50 different organizations in the public sector and the private sector, medical associations, of course, APHA, Men's Health Network, and nursing associations that talk about and give the landscape of some of the concerns that we have in men's health. They build on the 5 precepts for the Men's Health Caucus policy perspective, and they look to lay out an objectives and goals for enhancing the health of boys and men. One of our very specific goals is based on the fact that still, despite all of the technology that's available, all the advances in medicine, men in America still die almost 5 years earlier than do women. And that has health consequences to families as well as our country. So one of the very specific goals that we laid out in this document is to decrease that health disparity in longevity or mortality by half within 2 generations. And I think that's very doable. Again, if you want to look at a scoping document for what the nature of the problem is, what some of the best thoughts are about the impediments and to achieving healthier men and boys, and then some of the suggestions and very importantly, model programs that work. This framework document, I think, is a very useful tool.
President Obama and many others in the federal and state government sectors are working hard to develop programs for economic vitality. And there are also, in the private sector, many corporate initiatives to bring increased numbers of trade and technical personnel into the workforce. Would you talk about the link between health and wellness and how this plays out in terms of initiatives to enhance America's workforce? And are there particular concerns that you see about how men in the workforce deal with health issues?
Yeah, boy, that is a question with an awful lot of information around it. So just let me summarize very quickly. There is an inexorable link between health and workplace productivity and employability. For example, and there's lots of data behind that, too much to even really begin to summarize here, but just a very practical example. A man with poor oral health is just not going to be able to do well on a job interview. A guy who is physically unable to manage their diabetes is going to be absent more often than not. A guy who doesn't understand why they're feeling melancholy and doesn't have the social networks or the healthcare delivery to stay alert and on the job is not going to be engaged in technical work or work on the line or the ability to work in areas that require manual dexterity and attention. So to me, it's not only a matter of staying on a job and being healthy on a job, but it's also being able to be healthy and present yourself well to learn the technical material that you need to learn, as well as land that job. Quite frankly, you have to look and be healthy to get a job. Many employers in the private sector have in-house wellness programs that they bring to men. They've met with various degrees of success, but I think that is something that has to be brought to any sort of program such as My Brother's Keeper type program to make that decided link between the need for healthy men and employability and productivity.
You mentioned regarding men and work, physical health limitations, and I also think that one of the things we don't talk about that much is men and mental health. And we know that men are often not as likely to seek the help that they may need for things like depression. Can you just talk a little bit about that burden of mental health and how that's having an impact on men themselves and beyond?
another wonderful question with a very sad dilemma. The suicide rates in young men between the ages of 10 and 16, and in older men post 65, is 8 to 10 times higher than the suicide rate in women. So if you look at the end disastrous result, the catastrophic result of mental health, it's suicide, and as we see play out unfortunately in the media all the time, is acts of violence and despondency when a guy, as we used to say, snaps. And so I think mental health issues are extremely important. We don't do enough to help men feel comfortable in talking about these issues. Women, it's difficult for women, and I don't mean to just, in any way say it's easy, but men, generally speaking, don't have the social networks or the cultural history within their upbringing to talk about the mental hurt that they feel. What does a kid usually hear when they get hurt or when they're feeling blue? It's kind of suck it up and take it like a man. Well, that goes for the mental health issue as well. Some of the most severe problems occur in college years. While many believe that college men are more concerned about sexual health, when you ask them, when you take the time to really ask them what their concerns are, it's depression and anxiety over performing in grades. And similar in the workplace. Anxiety over performing in the workplace can be a real strong stressor for men, and also with the economic circumstances of today. If you're out of work, well, that not only impacts men's ability as hunter-gatherers and providers and self-esteem, but it also has dramatic consequences for the viability of their families. It's a very important issue, and here again, where we look at research, we don't know how to reach men and boys well in that regard at all.
So I think based on what you've said, that there's certainly an excellent case that you can make on the need to do more for men's health. And we're, in many cases, I think, failing men. But I also want to touch on something that you mentioned about the impact on families, because when we're talking about improving men's health and where we are now and where we need to be, a lot of that also has a tremendous impact on families. Can you talk a little bit about how men's health spills over into other areas?
Yes, it's not just about men for men's sake. The health of men, just as the health of women, affects their families, their communities, their employers, our whole social infrastructure. There's very little written about the economics of men's health, but one paper published in the past couple of years that I can recall shows that lack of attention to the overall health of men in America is costing our system over almost $500 billion in costs in poor health outcomes and premature mortality. And when you look at, and when we talk about enhancing the health of men, it's also a family issue. Enhancing the health of men, whether it's in terms of fatherhood and healthy fathering and child rearing, employment, living a full life after employment so that we're not leaving women widowed earlier than they need to be widowed with all the economic and social burdens that comes with that. The social benefit of enhancing our ability to provide healthier options for men are tremendous.
So you mentioned that within the Men's Health Caucus of the APHA, research is one of your major platforms.
Yeah.
And I was wondering if you could tell me a little bit more about where you think we are with research and maybe what you've seen through your work with the Men's Health Caucus in terms of promising new research or just people being interested in researching men's health issues.
Yeah, just as a barometer, when we first began the caucus, I believe that we had maybe 40 or so abstracts presented for a presentation at the national meeting. This year in 2014, for upcoming meeting 2014, we've had over 110 abstracts. They span the interest area from violence prevention to access to health care, HIV prevention. We're actually doing research and work and presentations along with the Women's Health Caucus with the Family Violence Prevention Caucus, as well as with the Caucus on Fatherhood and Maternal Health, all geared to providing, and one of my key elements to this is talking about best practices. I think some people are doing in local areas some wonderful things. So what I want to bring in terms of research is a very pragmatic approach. These are things that we've done. This is how we've gotten them done. These are the results and the overall outcomes for enhancing the health of our men and communities. So it's a very practical approach. We still need more research in pharmacogenomics, the ability and the differences in the way women and men handle medications and therapies. We need more research in gender-based delivery of healthcare across the ethnic and sociocultural continuum. So I think there's a lot of room for more research to learn more, particularly about how to engage boys and men in healthcare that we just haven't done over the past 30 or 40 years when, social norms have changed.
Dr. Giorgianni, you're a pharmacist by training, and I was wondering if you could touch on your experience as a pharmacist and as a health professional in terms of men's accessing care and also issues specifically related to medications and issues like medication adherence.
Yeah. Men are far less likely to go to the doctor than women, and when they do go, they wait far too long in the disease process. So what you end up with is a situation where simple issues with high blood pressure might go so long that you're dealing with significant cardiovascular disease and the potential for stroke, that management of depression or mood goes into a severe depressive state that renders someone incapable of working or loving. So men absolutely have to feel comfortable. Many of our healthcare environments, unfortunately, are not guy-friendly. The other is there's no guy doc. When you think of OBGYNs, they've taken up the ball and they deliver healthcare for girls and women at a very young age. Urologists try to pick up the guys, but usually guys don't identify with urologists as being a primary care provider, and they don't see them till they're 50. So we have this huge gap in perceptions of who the guy doc is, and we think family practice is a very good place for men to go to get that overall health care. The other issue is just men like to research things. And it's hard to get them to make a commitment to do something. But once they've researched it, and once they've made a commitment to do it, they're usually very, very adherent. But getting them to the stage to pay attention, to take action, feel empowered, because they don't like to be disempowered, and face it, the healthcare settings are generally very disempowering to men. You relinquish a lot of control. But if you help men research it, remain in control over their own health care, they're much more likely to be compliant than women.
Great, thank you.